Hello, it's Erica Jeffrey, number 1014318. I'm going to be showing you how to do tracheotomy sectioning and a dressing change for doing so best I can with my limited space and supplies. First, what I'm going to do is I'm going to verify my doctor's orders. So I'll see here, suction, tracheotomy, PRN, change the dressing, daily, PRN. I'm going to be looking at the patient's name and the birthday, making sure I'm going to the right person. So when I'm gathering my supplies, and I will be doing some hand hygiene, going in, introducing myself. Hello, I'm Erica, I'm your nurse. I'm going to be doing some care for you, I'm your tracheostomy, and I'm going to be noting that they're in a high flowers position, so move the bed if need be. I'm going to set up the suction machine and wash my hands. I'm going to make sure everything is working. I'm going to prepare my sterile suction tray. So doing so, I will first be opening, pretend that this is closed, and these are my sterile gloves. So be opening everything, and normally the kit will have sterile gloves inside. So we'll just take that out. Okay, and after opening that, we also have the tracheostomy care tray, and we'll open that at the same time as well. Go. Okay. I'm going to apply my sterile gloves. Oh, I gotta make sure. Also, what I did too is I put the oximeter on them, too, because you always want to check how their oxygen levels are when you're doing something like this. And I'm going to increase the oxygen level, like that's up behind the bed, and hyperoxygenate. Okay, and so now I'm going to apply the sterile gloves like so. So the right angle here on this video. And we always want to keep the dominant hand sterile. So I go in with the sterile glove. We'll pretend these are sterile because they have been on more than once with this practicing. There we go. Leave that there. I'm going to go underneath here. Keep this sterile and just make sure like so. Hopefully you're okay with that, this far hat. And make sure you just don't touch the rim. Very tricky to do. And oh, I got the odd. There we go. Okay. And we're fighting with it a little bit. Practice, practice. And just my fingers sometimes they'll get stuck and twisted. And just make sure you don't touch the end and pull them on. Okay. Now I got the sterile gloves on. Sorry, I was a little distracted there. Current suction, catheter to suction. Okay, so now I'm going to go in. I'm always going to make sure my dominant hand is available. I'm going to turn on the suction machine. Okay, and I am going to, and add a sterile glove hand. Okay, I'm going to go in here. This is what the cardboard, this is all sterile inside here. So then the end of the sectioner, sit in here. And I would hook this up to the machine, okay? It's really nice if I had a teacher showing me all these things, but it's really, retain sterile one hand and you will have sterile other glove. So when I'm picking this up and I'm going to the machine, I'm being careful not to touch anything with this hand, okay? Say it's attached to a machine, because I don't have a machine, okay? I'm going to, because I don't know how not to hold this. Suction catheter, I'm going to use, we're going to lubricate. Oh, it's also, ooh, this is so messy here. Okay, so in here too, you'll have, like in this tray, we'll pull everything out. We'll put the basin, we'll have a sealing water, we'll put that in there as well, because you want to lubricate the water and check if the suction is working. Once the suction is working, then I've got this, because you're going to check and see if pretend this is the trachea, and just check and see if the bandage is soiled or anything like that, and then go in with the suctioning. Try to maintain sterility as much as possible. Say that this would be sterile. This is so awkward. And then after doing so, I mean, give it within 10 seconds. Don't suction more than that. I want to also, if the bandage, say if this was soiled, we would change it, right? And notice, we would also clean it. We would have, just do a couple swipes. One here, discard, another one, discard, pat dry. I'd want to clean the 2 and the 4 margins, like around. I want to make sure that I pay attention to the outside of the canella and clean the stoma. So that's what I'm going to do with that after inserting things in. I'm trying to keep a sterile environment here, but like I said, this is pretty unnatural. I would always make sure I'm checking the SPO and hyperoxygen for the patient, and make sure that they're actively, that they can breathe. There is also, and I would remove my sterile gloves, wash my hands, verbalize, and document any findings. And then I'll also go and evaluate them too as well. Thank you.